Alright everyone, today we got part 2 of our low back pain videos. We're going to progress those exercises today to focus a little bit more on core strengthening in order to support your spine and reduce your low back pain. If you remember from our last video, we discussed the importance of relaxing guarded muscles and started the foundations of core strengthening. Today what I'd like to do is give you some more exercises that will work your core a little harder and help support your spine a little bit more.
Today we are going to start with bridges. Now remember from our last video, pelvic tilts are the foundation of all of our core strengthening exercises. We incorporate this by making bridges a 4-part movement. What I want you to do is perform a pelvic tilt and hold the tilt while lifting your bottom into the air. Try to keep as straight of a back as possible. Continue to hold the tilt as you lower yourself and release the tilt once you have made it back to the ground. So it goes tilt, lift, lower, release. Repeat this 10 times. Perform 1 to 2 more sets after a short rest. The next exercise is a straight leg raise. We aren't going to perform a full pelvic tilt with this exercise, but make sure you are contracting the same abdominal muscles as you would if you were actually performing a pelvic tilt. Straighten one leg and keep the opposite leg bent. Lock out your knee and lift your leg into the air to the top of your other knee. Pause for 1 second and bring your leg down slowly. Perform 2 to 3 sets of 10 repetitions on each leg. For this next exercise, you are going to need a thick pillow. Fold the pillow in half and place it between your knees. Again, we are going to contract our abdominals and simultaneously squeeze the pillow with our knees. This is called a supine hip adduction isometric. Don't try to squeeze the pillow with full force. Only squeeze 50 to 75% of your max effort. We are creating opposing forces to your anterior core, causing it to work a little harder, as well as coordination of other muscles that help stabilize your pelvis and spine. Perform 2 to 3 sets of 10 repetitions and hold each rep for 5 seconds. Lastly, we are going to perform supine hip abduction clams. If you have a resistance band at home, tie the band around your knees. If not, just perform the exercise without resistance. Place your knees and feet together to start, and you will slowly pull your knees apart. Remember, we are always contracting our anterior core abdominal muscles while we perform the motion. Perform 2 to 3 sets of 10 repetitions, slowly returning your knees together after each rep. It should take 3 to 4 seconds for your knees to come back together.
As always, thank you for watching our videos. Remember, if these exercises don't help or your pain gets worse, contact your physician or physical therapist. Give us a thumbs up if you like what you see, and don't forget to hit that subscribe button so you don't miss out on future videos. Take care, everyone.